And we are live. Hey there, it's Dr. J in the house. How we doing? Happy Friday, 2 days after the 4th of July. What's going on? Shoot me a message. We are live in the flesh doing a live Q&A. What's going on? Any questions? Feel free and hit me up. Happy Friday. All right. All right, couple of things in the news here. Article came out on infertility or on fertility, talking about nuts and actually helping to improve fertility. So pretty cool, because one of the big nutrients that are nuts, you have essential fatty acids, you have zinc, you have selenium, you have lots of minerals. You got to be careful with nuts though, because they can have mineral blockers in it that can block mineral absorption and uptake. So, soaking them or blanching them will definitely help and for the absorption. But again, they did study, standard American diet, just added a couple servings of nuts a day, and they saw some improvement on the sperm count side for the guys. That was the big thing they were looking at: sperm count, improvement in morphology, motility, and overall sperm count. Apologize about the downward angle here on Facebook. I can only run the live Q&A through one camera, so I got to do it over my phone, which is in a corner here. All right, hey Spivey, how you doing? Any questions? Feel free. I typically don't do my talks this late in the afternoon on a Friday, but hey, we're rolling. We are rolling, baby. Any questions, let me know. I'll chat for a bit longer. What else is on your mind health-wise, guys? Feel free and chime in. Did some Thyroid Reset Summit recordings today. We talked to a couple of docs, experts in thyroid autoimmunity, kind of diving in deep to that. So feel free and subscribe to the Thyroid Reset Summit, thyroidresetsummit.com. Question from Neil. Dr. J, any tips for improving oxygen saturation levels and general lung health? Thanks for your podcast and videos. One of the best things to do to improve oxygenation is, number one, decrease inflammation. Of course, right? Decreasing inflammation from your foods is going to open up your blood vessels. Of course, there's natural ways you can get, I think it's nitric oxide, I think it's NO. And you can do that with beetroot powder. Excellent way to kind of get the vasodilation in there. One of the biggest things that will decrease nitric oxide is excess fructose. So if you're doing lots of high fructose corn syrup, lots of added sugar, that will decrease your nitric oxide endothelial synthase, which opens up your blood vessels. So keeping your body more sensitive to your carbohydrates, dialing your carbohydrates to what you need, healthy proteins and fats, is the way to go. I mean, from a structural standpoint, there's a couple of devices you can put on your mouth that will help with the breathing aspect. I think there's one device called Power Lung. And then on the general lung health, there's one more thing I wanted to add on that. Oh, nose breathing. Nose breathing will help activate the parasympathetic nervous system. The more you're breathing throughout your mouth during the day, that activates the sympathetic fight or flight nervous system. So you can get tape for your mouth. So at nighttime, you're forced to breathe through your nose, or you can just be proactive and sit up straight and good nasal breathing. That gets the parasympathetic, the olfactory cranial nerves that are sitting way back up here, and that really help activate that parasympathetic nervous system. All right, guys, any other questions? Feel free, keep them, chime them in. I typically don't do talks this late in the day, so we may not get our usual crew here chiming in. Anything else? So on the Thyroid Reset Summit today, a couple of topics we chatted about was autoimmunity. So most people that have thyroid issues actually have a thyroid autoimmune problem, and they don't even know it. Most conventional medical doctors, they aren't assessing for thyroid autoimmunity. Why? Because it doesn't even change anything, right? If you come back with antibodies for your thyroid tissue, which most people that have thyroid issues have some degree of antibodies, it does not change treatment. Right? Most doctors are just going to give Synthroid, a synthetic thyroid, just medication to get that TSH down, right? Thyroid stimulating hormone goes up when your thyroid hormone drops. It's inverse, right? So imagine your spouse, you're trying to talk to them. If they can't hear you, what do you naturally do? You increase the volume of your voice. If your thyroid hormone's low over here, which is the equivalent of your spouse not being able to hear you, the volume goes up. So does the TSH. So when you're diagnosing thyroid issues, a lot of times it's just off the TSH. Once that TSH is good, they don't care. But autoimmunity, meaning there's antibodies in the background that are literally coming in and attacking the gland, and we want to make sure we get to the routine the actual root underlying cause of why that's there to begin with. Luke writes in, for reoccurring morning stiffness and pain for the last 3 to 4 years, what do you suggest to investigate? Can't seem to find the right practitioner. I work with functional practitioners. Regarding stiffness in the morning, inflammation, Inflammation is the first thing. So always look at the diet, autoimmune or a anti-inflammatory kind of paleo template is going to be helpful. If you're doing a lot of exercise, you probably need to look at finding a practitioner that can help with pliability. Tom Brady does a lot of specific massage that kind of works on, taking the muscle and improving pliability, kind of like a myofascial release, active release practitioner would be ideal to help with the pliability aspect. Things you can do on your own is foam roll. That's super helpful, and just find a good myofascial release or active release chiropractor to help with the pliability component. And again, you may want to look at cutting out nightshade vegetables as well. Sometimes they can create extra stiffness too. That's the tomatoes, the potatoes, the eggplants, and the peppers. Think for yourself writes in, please make an entire episode on how to treat problems with fat absorption, step-by-step process. Well, when we look at digestion, right, we need adequate hydrochloric acid to activate our enzymes in our stomach. So we want a nice low pH, right? Lower pH equals more acidic. So hydrochloric acid is dumped out that basically activates pepsinogen to pepsin. That's a proteolytic enzyme to break down protein. The acidity also then, when that food, all that chyme gets mixed up and dumped into the small intestine, that triggers release of the pancreas of various proteolytic enzymes. These enzymes break down protein, right? Where it could be trypsin, chymotrypsin, etc. Also lipolytic enzymes. These are enzymes like lipase that break down fat. And then there's a hormone that's also produced by the small intestine called cholecystokinin. This hormone triggers the gallbladder to contract and squeeze out bile. Now, its primary trigger is having enough acidity. So if we don't have enough acidity in the stomach and that food doesn't get dumped into the small intestine properly, we're not going to have that acidity to trigger our gallbladder to release. So you can see there's a couple of dominoes that have to fall to make all this happen. We need HCl acidity. We then have that HCl chyme, because the food now mixed in with the HCl is now called chyme. Okay, that gets released to the small intestine. Small intestine then triggers pancreatic enzymes, bile salts, and that's all gets emulsified and broken down. Does that make sense? Hope it does. If you guys have a good understanding of just basic physiology of the digestive system, you can understand a lot. Now, sympathetic stress, right? Stress will decrease that parasympathetic response, which is what triggers the HCl and triggers all those things from happening. So you really want to make sure that you're keeping stress under control when you're eating, because that is really important to have dialed in, or you'll shut off that parasympathetic response, which is important for those digestive secretions. Gupta writes in, hey, doctor, whenever I have a bowel movement, I don't feel empty. I do generally have one bowel movement a day in the morning. Is it considered constipation? Any supplements you can recommend? So you want to pass at least 12 inches of stool a day. Again, if you're bigger and you're eating more, maybe a little bit more, but at least 12 inches of stool a day. Again, there could be some dysbiosis or SIBO or low stomach acid or something happening that could be driving that. Those are all possible things. Food allergens, grains, inflammatory foods could be doing that too. I would just start off with a little bit of magnesium citrate or magnesium oxide to get the bowels moving, and then dig into what could be going on with the gut. See here, Doreen writes in, my recent bone density scan showed 2.5 decrease in spine and 2.5 increase in the hips. Does that make sense? So that's a DEXA scan, right? Is that a Z score or a T score? And if you can give me reference ranges, that'd be helpful. I don't have those reference ranges memorized. But with bone health, bones are half protein, so make sure your digestive system's working. Make sure you're eating enough protein. Get collagen into your diet. Get resistance training into your diet. You need the piezoelectric effect working in your favor so you can build up those bones. That's just basically resistance going into the bone to then stimulate the reabsorption of minerals and amino acids. But 13 minerals make up your bone, and so does protein. So make sure you get those things dialed in. As a female, progesterone and estrogen is also really important as well. So you want to make sure that's dialed in too. How much water should I drink in a day? Good rule of thumb, Dr. Batman Gilish, your body's many cries for water is half your body weight in ounces is pretty good rule of thumb. Or just take a peek at your pee when you urinate and make sure it's kind of a light tingy yellow, not clear, but not super yellow either. Do you think bunions can be corrected without surgery? Thanks again. It depends. I mean, as a female, well, your name's Neil, so I'm guessing you're a guy, but females tend to wear like a lot of heels, which are going to like create a lot of, valgus stress on this inner big toe, which can create bunions. And then you'd want to look at, make sure your muscles, make sure everything's working really well. A lot of women, they have this Q angle from the hips, right? The hips are here, the knees kind of knock in a little bit, and they get this valgus stress. So if here's your right leg, the knees kind of come in and the foot kind of comes out, which then puts all of the stress on this big toe. So you got to have someone really look at you, a good functional movement person, and someone that does kinesiology that can test your muscles to make sure they're turned on and working well. A lot of women, they have their glute medius just totally turned off, and then their knees kind of just knock in. How can I lose belly fat and get abs? Well, first thing is start becoming a fat burner, get carbohydrates under control, kind of a keto paleo template, and then do smart exercise to put on muscles and increase your metabolism. But I have whole podcasts and videos on that, so I recommend that. All right, let's see here. Charlie writes, saying, eating meats from Safeway versus grass-fed meats make you feel way worse. Energy levels or brain fog. Short-term, it's just a long-term way of reducing disease. Again, can it make you feel worse? Try, if you're going to Safeway, you don't have a choice to eat a grass-fed organic kind of thing. Try to do at least organic, or at least free range. That's going to be hormone antibiotic free. That's at least your best bet. I would start there. Would it make you feel worse? Hard to say. I would test it on both sides and see what works best for you. Is it bad to pee yellow when taking vitamins? No. If you're taking too many B vitamins, you will pee some of them out. That's fine. If you're not peeing them out, that means you're probably not getting enough. So I'd rather have your pee be yellow from B vitamins than not enough, because that means you're probably not getting enough B vitamins. I'd rather overdo it. I do take digestive enzymes, 3 tabs before meal, but stool is still yellow and floating, dry skin. So I would get HCl on board. I would get enzymes on board, and I would get bile salts on board. I would take them all individually, enzymes, bile salts, and HCl. I would work the HCl up to tolerance to make sure you're maximizing your digestive capacity. I would do that to start. And then after that, I would get a stool test and see what's going on with your gut, because you could easily have some other issues happening with like an infection or something. 1 sec. Perfect. All right, cool. All right, let me keep on rolling here, guys. Any other questions? Keep them chiming in. See here, Cynthia writes in, is phosphatidylserine good for kids? If so, what could be a good dose for a 7-year-old? Also, do you have a complete multivitamin for kids? So I would have no problem giving phosphatidylserine. Serine's an amino acid. I think it'd be safe. I would just take a 7-year-old. Let's say the average 7-year-old weighs 50 or 60 pounds. Again, it could be off by a little bit. I would probably decrease the dose to maybe 75% less of an adult dose. So if I normally gave 4 capsules, I may just give 1 capsule to a 7-year-old. But again, if you're doing that for like relaxation or to calm them out, maybe try something more benign like magnesium first. Do that. You could also do some L-theanine and GABA. Those would be good. And if you wanted to do the phosphorylated serine, that's fine too. Okay, cool. Okay, T-score. Okay, I'm 18, got gyno because I really have high SHGB, have trouble walking due to weakness. So if you have high SHGB, that's sex hormone binding globulin, again, I would get the diet under control, because I think you really have to make sure that insulin resistance is dialed in. That's going to be the bigger cause of gynecomastia for guys. With high levels of insulin, you're going to increase an enzyme called aromatase, and that's going to convert your testosterone to estrogens. I would look at that first. Okay, here. Cool. Why is skin on my toes stripping for no reason? Let's see here. It could be from some gut stuff. If you look at some of the acupressure meridian points, some of the skin, some of the toe and foot stuff correlates to the organs or to the intestinal tract. So look at an acupressure chart for your feet, and that may give you a good rationale. I know, like, if I do a gut cleanse or a candida cleanse, I can see like the arch of my foot, the skin peels a lot. So that could correlate to some part of the body. I would look at that and see how you do. Spivey writes in, Savi Vista writes in, hey, Justin, I'm age 48. I've noticed that my hair and skin appear to be thinning. Do you think premenopause or possibly a deficiency in thyroid adrenals? Thank you for your time. So you are at that age, Savvy, that it could be, very possibly could be premenopausal stuff. Question I would have is, are you missing any cycles yet? Are your cycles pretty stable? The second thing I would look at is, what are your cycles like? Do you have a lot of hormonal imbalance or PMS? Do you have any low thyroid symptoms? Do you have, how long has the hair been thinning? Do you have cold hands or cold feet? Do you have outer third thinning eyebrows? Do you have some mood issues? Do you have constipation as well? Have you checked your basal body temperature? So I would definitely look at potentially the female hormones. I'd look at the thyroid. I would also look at the gut, because you absorb all the nutrients to make healthy hair and healthy skin. All the amino acids and essential fatty acids come from your diet. And if you have poor digestion, that could definitely create a bottleneck. Let's see here. Great name. Spot of Justin. I love it. How do you get rid of eye floaters? Hard to say. I would look at just getting the inflammation down in your diet first. That'd be the first thing. Gluten is a big one. Luke writes in, my 4-year-old daughter really struggles to have normal stools. She's mostly constipated and has small to medium pellets. Where should I start and try to correct this? She doesn't like veggies. So you definitely want to get in vegetables or some healthy carbohydrates. For me, it's really simple. Find out what you're in. I'm a parent too, so I find out what your kid wants. They don't get to eat that until they eat the foods that you need them to eat. It's that simple, right? Hey, you want, your blueberries, you want your whatever Hail Mary tart dessert, like whatever that is, dangle it. You don't get it until you do this first. It's that simple. And then the first thing is, make sure there's no inflammatory foods or extra refined sugar in there, gluten, dairy, those kind of things. And you can start with giving them a little bit of enzyme. They have some enzyme and HCl wafers for kids. I would start with enzymes and HCl and see how that goes first. Charlie writes in, what's for dinner tonight? That's a great question. I'm at my in-laws. You can see the background's a little different. I got my little portable mic here. But we got a Green Chef Paleo organic meal. I think we have a nice little tuna dish that may get cooked up, or chicken tenders, I think. So that'll be fun. I'm 13 and I'm going through puberty. Any tips, sir? Yeah, keep your diet clean. Just keep your diet clean. Good paleo template. Major advantage. Most kids your age at 13 are eating absolute crap, and their parents aren't doing a damn thing to guide them in the direction of what to eat good. So if you can just eat really good, you may need more carbohydrates. So if you need more carbs, sweet potato, squash, healthy carbs, good fats, good proteins. If you need to do some fruit, try to lean more on the berries and the lower sugar stuff. If you need some starch, you have the starch. Have enough protein, have enough fat. But most kids eat like crap, so you'll have a huge advantage eating healthy at your age. Jeff writes in, what do we need to test again? My dad tested positive for H. pylori. I've been on a prep pack. And he's been on a prep pack. He's been having lots of weird body aches and pains. And same here. I'm hitting the HCl and GI Clear too. Jeff, we got to check in, man. You've been on the herbs way too long. We got to retest you. We got to make sure that you're on good healing nutrients for the gut lining. If you're doing too much acids, that could be irritating your gut. So if you're having inflammation and pain, decrease that HCl, come off it. Just do some enzymes in the meantime. Do all of the good GI restore and those healing nutrients like the L-glutamine and the ginger tea and the slippery elm and the deglycerized licorice. And then just notch up those enzymes and really cook your food well. To kind of do a crock pot thing. So it really helps pre-digest the foods. Hope it helps. Get in to see me ASAP. Charlie writes in, have you seen your patients improve their testosterone dramatically through your protocols? Yes, I had a patient just last month go from 300 on their testosterone or 270 to almost 900 in 1 month. That's ridiculous. That's like an 80% improvement in 1 month. All right, let me go to my YouTube crowd, or my Facebook crowd over here. Hey there, Sherry. Hope you're doing well. A quick question. I wanted to lose weight fast for a wedding. What can I do short term? Well, I know you've done really well with HCG. You could do a 21-day HCG template. That's always an option for you. You could just go keto again. And then I would just do first thing in the morning, empty stomach, interval training, 20, 30 minutes interval training, first thing in the morning, empty stomach, get your metabolism revved up, tap in the fat easier because there's no food in your tummy at all. But make sure the exercise is short term and keep the carbs super, super low. You could even go a little bit lower on the fat too. You get moody, you get grumpy. Those kind of things may cause you to have a little more PMS, but you will lose a little bit more weight going low carb and low fat, but you won't feel as good. So not a long-term solution. Lisa writes in, what supplements do you suggest for Huntington's? So Huntington's is, I think it's like Tay-Sachs, right? It's like something that's a genetic condition that you're born with. So I would want to probably recommend specific labs so I could be, more specific regarding what your nutritional deficiencies are. So like an organic acids or spectracell or making sure your gut's good. I would really make sure all those things are dialed in. A lot of these rare kinds of conditions, I find they tend to be autoimmune. So I wouldn't be surprised if there's an autoimmune component connected with some of that. Let's see here. Alex writes in, I become allergic to eggs and I don't know why, but I can't eat them anymore. Pull them out for a month, go through the 6 R's. Remove the bad foods, replace the enzymes and acids and bile salts, repair the gut lining and the hormones, remove the infections, reinoculate probiotics, and then retest. But I would work on the gut next. All right, let me go back here. Okay, Jeff writes in. Thank you very much. Yep, set up an appointment. Feel free and let me know what your new email address is, Jeff. Have you had any patients with stiffness at night while laying down? If so, what can be the cause? What's the low-hanging fruit possibly to reduce stiffness? So, I mean, what's the context? Are we talking after a long day of physical work, exercise? Like, are you doing deadlifts that day, or is this kind of just all-around kind of thing? And are you stiff when standing? Are you stiff when sitting? I mean, the low-hanging fruit first is just get a darn good mattress. I'm a big fan of Tempur-Pedics, so I get a good Tempur-Pedic kind of mattress, start there. You can always do a little bit of foam rolling before bed. Kind of foam roll the upper back, lower back kind of stuff. You can even get one of those balls too that you can really kind of get into the piriformis, into the glutes better. I would just start there and see what happens. See here, guys. All right. Anything else? Feel free and let me know. I got just a few more minutes, 2 more minutes. Who wants to get their last questions in? Feel free and let me know, y'all. All right. All right, I think I'm going to go bounce off here. I think you guys are happy for the weekend here. All right, hope you all have a phenomenal weekend, and we will talk soon. You take care, y'all.